Hello, Paula.
Good morning. Can you hear me?
Yeah. Could you please
How
turn
are
on
you?
your camera?
I'm sorry?
Could you please turn on your video?
Yes, got it.
Yeah. How are you?
I'm good. How are you?
I am good, thank you. Welcome to the Global Virtual Summit 2026, Paula.
Thank you. This is my first virtual thing.
Yeah. Before going to your session, I would like to introduce you to our audience. Yeah. Paula Bagel is a licensed massage therapist, certified clinical and holistic aromatherapist, educator, formulation specialist, and international speaker specializing in evidence informed aromatherapy and holistic wellness. So, clinical practice, education, and global presentations, she advances the safe, science based application of botanical therapies in integrative healthcare. Her work empowers practitioners to incorporate evidence based aromatherapy into patient centered care with confidence and expertise. That was a fantastic bio, Paula, and the stage is all yours.
Thank you. Good morning, everyone from West Palm Beach, Florida. I am going to share aromatherapy. I've worn many hats in many careers, but my passion's always been working with essential oils. Today, we're going to talk about self-care, things that we forget about. The topic of stop and smell the roses. There's something to that. So I'm going to share my screen. Okay. Okay, let's see if I can get this. Desktop. Okay. I need to share my screen. Where am I? Okay, I lost everybody. Hang on one second. Okay. Open. Desktop. Sorry about this. This is not how I expected this to go.
Yes, Paula, could you please click on upward
Ah.
arrow icon?
Okay, my PowerPoint is not loading, but I'm going to talk about inhalation of essential oils. We live in a very stressful world, and we don't take time to stop and smell the roses, which is hugely important. We need to take a minute for ourselves. And there's been a lot of hype over essential oils over the years. There's also a lot of misinformation on the internet, and anywhere you look, you can actually you can totally see everywhere. Everybody's using essential oils. Everyone's using aromatherapy. But is it safe? Is it effective? Sometimes just taking a walk outside, smelling the air around you, take a deep breath in, take a minute for yourself to smell the air. A cup of coffee, a cup of tea. Let's see if I can share my screen again. Things that you can appreciate. What's your favorite smell? Coffee, tea, essential oil. Sometimes you can just take one essential oil. Everybody knows about lavender. You know, everybody knows about lavender, right? That's the go-to. That's the go-to oil. But it's not always the best case scenario. Not everyone is comfortable with lavender. We have peppermint. We have peppermint, we have lavender, we have spearmint, which is a softer essential oil. Just taking the time, rose, flowers. I'm having difficulties. I'm so sorry, everyone. This is embarrassing. The fact that a cup of coffee, a cup of tea, diffusion of essential oils, lemon, citrus, anything that's happy, bright, uplifting is what we can use. Oh my God, my computer. And if you've ever had like an essential oil diffuser, you put your essential oils in water and you diffuse it in the air. Again, happy, bright, uplifting, anything that brings you joy. If you smell a skunk, if you smell a cigarette, everybody immediately we tighten up. It's frustrating, right? You're like, oh, that's a terrible smell. Fumes, gas, toxins in our environment. So we don't recommend those types of aromas clearly, right? A fresh batch of flowers in your nose, anything that's rosemary for remembrance. So herbal history, fragrances have been used for thousands of years. I'm totally winging it now. Egyptians, Hippocrates, an aromatic bath daily is what people would recommend. Hippocrates, but it's not always our Glade plugins and those types of things. It's real pure plant oils. There's a lot of confusion out there. There's a lot of information out there that's not pure oils, right? You want the Latin name, you want to know that the company is reputable, you want to make sure that is it a pure organic essential oil. And we don't smell directly from the bottle, right? We put it on a cotton wick, a cotton ball, reed diffusers, and that's how you bring in your aromatherapy. You can just sit and smell. So I could do florals, I could do citrus. Again, rosemary and peppermint are stimulating for cognition, brain focus. A lot of times we're not using our brains fully and completely to keep our brains strong, mental health. People do crossword puzzles and such, and we're so on all the time. Do we actually take the time to stop and smell the roses? Do we stop and take an inhalation of even one single note? It doesn't have to be multiple essential oils, right? It can be anything to that makes you feel good, that makes your body say, "Oh, that smells so nice." Okay? Anything that, could be lemon, could be orange. Again, lavender is calming. Peppermint, sometimes peppermint is, woo, really strong. If you look at the properties of the plant, you can see that peppermint grows wild, right? That gives you what the plant's personality is, where spearmint's a little softer. So if you want that mint, there's bergamot, and then there's bergamot mint, which is distilled from the leaf instead of the cold pressed rind of the fruit. It's great for anxiety, depression, stimulating your senses, focus, clarity, sleep. How many of us don't sleep? So frankincense, lavender, sweet marjoram, Roman chamomile, those are all essential oils that help you bring yourself down and help you sleep. We don't get enough restorative sleep, so when we get up in the morning, our brains aren't firing. We're not getting that cognition that we need to. So we want to stimulate our neurons. So when I smell something directly through the olfactory system, it immediately hits our memories, our limbic system. It helps us regulate flight or fight. And we need to set our intentions for the day and set our minds for the day. So I get up in the morning, I have my water, I have my coffee, you have your vitamins. And then I'm like, which oil is going to get my day going? How am I going to focus for the day or de stress for the day? You might have an important meeting, right? So, aside from topical applications of essential oils, we have just inhalation. I was recently a speaker at an international aromatherapy conference where we talked about the benefits of just inhalation. You could walk into a bakery and then just smell the bread, coffee, peppermint tea. There's something to be said for chamomile or peppermint tea. Just sit there and inhale the vapors, right? Just reset yourself. Take the time for self care. And it's as simple as smelling an essential oil or a couple of essential oils, depending on what your needs are, depending on what your focus is. What do I want? Maybe I want to quit smoking. So you can inhale on a aroma stick, which I don't have my picture. It's a cotton wick, and you drop about 15 different essential oils, and you can use black pepper, frankincense, and um, frankincense, black pepper, and maybe ginger, something to peppermint to stop your cravings for cigarettes. There is, in my PowerPoint, maybe the team can upload it, is, a aroma psychology chart that I have permission from the Tisserand Institute that I've worked with students, mental health students, and people that are doing therapy or going through therapy, helping us connect with our aromatic plant allies, helps us set our intention, helps us heal, depending on what issues you're working on. But again, something simple as quitting smoking, nausea. So chemotherapy patients, pregnancy, ginger, lemon, and spearmint. It actually helps just by smelling it, helps calm your digestion, it helps calm the nausea. And that could be used for, different types of nausea, migraine nausea, right? Frankincense, peppermint, lavender, it helps kind of calm that down. But again, less is more. I only need a couple of drops because if it's pure plant concentrated essential oils, I only need a couple of drops. And then your mind, your olfactory system, it'll know where to go in your body. A lot of people, I also consult for spas, and it's not always about how many different oils I can put on my body, right? Because my body still has to metabolize those. But for self care, just stopping and smelling, slowing down, pick essential oil, make sure it's a pure plant oil, and make sure that you're in a space of your own, a quiet space of your own, where I can just smell, just smell those oils and take the time. Put some flowers in your office. Essential oils for healing of the heart, jasmine, neroli, ylang ylang, rose. All those oils are heart healing. If I'm at my desk at work, I'm gonna say, I need some pick me up. Grapefruit, sweet orange, lime, lemon. They're heart opening. They're expanding. They're cephalic. So when I smell citrus, woo, it goes right up, and I'm like, wow, right? This is great opening, expanding energy. And when you want to heal your heart, you sit there in a quiet space and just smell your florals, right? And as you smell something, you can say, okay, where do I feel that? Where do I feel that essential oil? How is it affecting me right now? So you can use it as a guide to what essential oils that you need. I work with a severe von Willebrand's disease group where I'm very cautious about. It's a bleeding disorder that there's really no cure for. They have to have infusions and everything else. So, what helps them emotionally, right? And this is all just inhalation for self care, mental support, emotional support, just stopping and smelling something to stimulate or sedate you or calm you with just pure plant oils or just flowers, pure flowers, a cup of tea, a cup of coffee, just taking that time to let it sit and let it stimulate your mind. So that's what my passion is with essential oils. It starts with simply inhalation. Children going through chemotherapy, infusions, autistic ADD, I let them choose what works for them. And sometimes I make a blend of just like sweet orange and vanilla because it's calming. Good question. What is aromatherapy? Okay. Aromatherapy is steam distilled or cold pressed or CO2 extracts of a plant. So, say I've got lavender, I've got all this dried lavender and it goes into a big distillation, right? And I steam distill that plant. And what comes off is the essential oils of the plant. There's also hydrosols, which are the water component of that distillation, and that is really subtle for animals, for seniors, for babies. So it's a subtle aromatherapy. So that is a really good question. That would have been on my slide. What is aromatherapy? And the difference between essential oils and fragrance oils are fragrant oils may have some chemical constituents from the pure plants, but it is not a pure plant essential oil. Usually they're adulterated or they're pull out certain chemical components from that essential oil that is used in a larger quantity for like candles, perfumes, that type of thing. So yes, aromatherapy is your distillation of your pure plants. So I'm sorry about my slideshow. So yeah, just taking the time for self-care really is just stopping and smelling the roses. Stop and pick out an oil and smell it. Um, I do have I teach classes. Okay, so what are the limitations of aromatherapy? When should I not replace medical treatment? I never replace medical treatment, never ever. So, for the purpose of this talk, is just inhalation, right? So, it can be a companion to medical treatment. I'm not talking about ingestion. I'm not talking about even topical application at this point. This is just their inhalation just for self-care and just what do I need today to help me ground or stimulate myself. It never replaces medical treatment. Never, ever. I am not a medical practitioner. I work closely with all sorts of medical doctors, but this is not a replacement for anything. Commonly used essential oils are probably the ones that you see on the internet. Peppermint, lavender, tea tree. Tea tree is not great for inhalation. It's not my favorite go-to for aromatherapy. So tea tree, is like more of a topical, a fungal treatment. I would put that in a topical one, but just self-care aromatherapy, how does it support self-care? Is I'm taking a minute for myself and I'm just going to stop and smell peppermint, rosemary, grapefruit, lavender, frankincense. If I have nausea, we talked about the lemon ginger spearmint, just to smell it on a cotton wick, a cotton ball, a diffuser. Those are things that how it supports self-care, because it's supporting my emotional brain, my mental brain, right? Once I stimulate that olfaction system that hits my limbic system, my cognition, that's how it supports self-care. And hopefully at some point, this team can upload my PowerPoint. So any more questions? I teach classes. I'm going to put my email in the chat. Thank you for your time. Again, I apologize for not having a PowerPoint.
It was a wonderful talk. And yeah, we have a few questions from our audience. We will directly post it to your email and you can answer there.
Okay, I'm so sorry about my PowerPoint. What a bummer.
No problem, Paula.
But anybody wants to ask me any questions, I put my email in the chat. I teach classes. I'm happy to answer any questions. Hopefully share my PowerPoint if somebody wants me to present it for them. I'm happy to do that as well. I do corporate events. I do all sorts of things with essential oils, spa consulting, corporate custom blending, education about safety.
Yes, Paula, thank you. Yeah. Please stay on the backstage and join the next session, Paula.
I will.